Hey everyone, what's going on? My name is Deirdre. Welcome back to my channel. I am 107,000% sitting on my floor on a stack of pillows, and I just moved into a new apartment, so I'm trying to find like the best film place, and low-key, if it's not the kitchen, this might be it. I just got off a 12-hour shift. I've literally been up since 2:45 in the morning, and I was gonna film for you like a day in the life of a CNA, but it was just, first of all, I can't film. You cannot film in a hospital or patient care setting because it violates HIPAA, and I know that's the tea that we all want to see, because before I became a CNA, I scoured the internet everywhere for these videos, and I'm like, come on, someone sneak a little video in there. But now I'm just like, yeah, I'm not gonna risk it in any way, shape, or form. And I thought that I would film something a little bit different, talking about COVID and just kind of like how it's been and all that kind of stuff. So right now it is, I usually put my watch on this hand. Ugh. Let me switch. Right now it is 5:34 p.m. I've literally been up since 2:45 in the morning. I'm not joking at all. I worked a 12-hour shift. I started at 4 a.m. I got off at 4. It wasn't the typical 6 to 6, because if we did that, it would have been like, basically I would have been there for breakfast, dinner, and lunch, which is just feeding times in general are just like when shit hits the fan. I'm not gonna lie, like shit literally hits the fan. I wanted to make a day in life of a CNA, and I started filming last night for you all, but I realized it was just way too hectic, too much, and my schedule is very like so I was just like, I just don't really have time to like film and make it cute, or like film and make this like YouTube presentable. The other thing is, before I became a CNA, which is a certified nursing assistant for those of you who don't know, I did look up so many videos on the internet trying to find like someone filming, and no one could film. Like you can't film in the hospital, you can't film with your patients because it violates HIPAA, so it's really hard to get that content. So unfortunately, I was like, this video is gonna be a flop. But I was like, wait a second, we're literally in the middle of a pandemic, and I kind of just wanted to talk a little bit about that, because this is a really unique time in my life right now, and I never expected to be here. I mean, I'm not just talking about the pandemic, because none of us expected this, but I just mean like, I didn't expect to be working in a really high risk environment during any kind of pandemic. So right now it is 5:36 p.m. I got up at 2:45 a.m. I worked a 12-hour shift. So I kind of just wanted to go through that and like what my experience has been as a CNA, because a lot of people are really getting put into the medical field, and it's a very crazy, unique, different, 100% scary time right now, but it's also an amazing learning opportunity, an amazing time to grow and strengthen your medical skills and really figure out, you know, is this something that I really am enjoying that I'm doing? So I did just want to like have a candid talk about that. So first and foremost, in January of this year, I started to take classes to become a CNA. So every single weekend I was taking classes from 6 a.m. to 3. And that was on top of working like 5 days a week and taking taking like my prereqs for nursing school. So it was a lot. And then literally my last week, so you have to do theory and then you do clinical, and you have to get like X amount of hours. I'm not really sure what the hours are, but the last week of my courses is basically when everything went on lockdown. I think it was like the last week of March here in California. So they canceled our final classes, and I took that as an incentive to go home. And I didn't really know what was going to happen with regard to getting my CNA license, with regard to working in a medical setting. I was also volunteering in a hospital at the time, which also got put on hold because it became a really high risk environment. So I just kind of went home, and I was like, wow, bummer. Like I was 1 week away from becoming certified, but you know, it's for the better. I'm gonna go home, all that good stuff. So I went home, and then 2 months into like literally chilling and relaxing and probably being as safe as I possibly could be, I was like, yeah, I think I need a job. I think I need to do something with my life. And I also really wanted to get clinical experience for my grad school applications. When I say this out loud, I'm just like, what am I even talking about? It's the middle of a pandemic. Like, why would I want clinical experience? But that's what I did. So I started to apply to a whole bunch of jobs because I was like, you know what, this is a prime time to apply because a lot of places are hiring new grads, as we've heard, like new grad doctors, nurses, people that haven't finished their clinical experiences, as well as CNAs. And you know, if you only have like a little bit left to go, people are hiring. And I was like, this is a really great, I like to see everything as an opportunity. So I was like, this is an amazing opportunity to just like get my foot in the door and hopefully land a really great job and kind of like test out the waters and so on and so forth. I'm just gonna figure out as I go. So I applied to a whole bunch of different places. I landed a job at a post-acute rehab center. So basically we see patients that typically are short-term. They're coming after surgeries, typically from the hospital, and they come to our center for rehabilitation services. We have a wound doctor and a wound nurse, and so a lot of people do have wounds, and so aside from doing their rehab, a lot of people are getting the wound treatment. So those are the two big things that we see. And then my job as a CNA basically centered around patient care and helping the doctors, the nurses, the physicians. I don't really work with the occupational therapist or the physical therapist, but I basically do get the patients ready to go to therapy, so on and so forth. So with COVID, that really changes everything because first and foremost, the patients can't really be leaving the vicinity at all. And we don't really have a lot of patients coming from surgery because the more patient contact that there is through the outside world, the higher chance there is of bringing COVID into the facility. Now this isn't how all facilities work, this is just how our facility works. So when they called me, I submitted my application, they called me, I interviewed, and they'd explained to me how at the time they had no COVID cases and basically kind of like how the facility worked in the sense that they're not seeing sick patients, but patients that are getting care for rehab, so on and so forth. So I was like, okay, cool, like this might be a really good like first CNA job. It was also a smaller vicinity with 55 beds. When I did my clinical training, I did it in a 300 bed vicinity. And the second COVID hit, that vicinity got like so many, I'm saying vicinity, it's facility. If anyone saw that, just pretend I didn't do that. But that facility got hit pretty hard with COVID. And so I was definitely really nervous about being in a high risk environment. So at the time I was like, okay, great, like I'm excited to work, I'm excited to like get patient care, and I'm just like ready to go out. They explained the PPE that they're doing, the precautionary measures, so on and so forth. So it seemed like a great thing at the time. It still does. I don't know what I'm talking about, past tense. So basically I've been working here for a few months now. I've got a lot of amazing patient care experience. At the time, we didn't have any COVID positive patients. So with that being said, like a new patient that would be admitted would be on a 14-day isolation period. Was it a 14-day isolation? No, if they didn't have 2 negative COVID tests, if we were awaiting 1, I believe they would have like special precautionary measures where we'd have to fully gown up, mask up when we went in the room, change our gloves, do like the whole everything. And then every other room we were able to just like go in with a mask obviously, but like de-gowning, no face shield, all that kind of stuff. And then gradually over time we did get COVID positives, and not necessarily with the patients but with the staff. And that definitely put stress on everyone because again, because of HIPAA, we don't know who has COVID, so on and so forth. After that happened, gradually things kind of started to increase. I'm not going to divulge too much information just for like privacy, but now we're basically in, obviously we've hit like the second wave. No, we haven't even hit the second wave of COVID, but we've seen an increase of COVID cases, unfortunately, especially in California and Southern California. So basically every single room is now an observation room, which means that we're fully gowning, masking, changing gloves, so on and so forth. And it's honestly been really stressful. And this whole pandemic, like you hear about COVID and you're really nervous and you're really scared, and then it really starts to hit home when you know people that are getting positive when you're working in a really like high patient care environment. So initially when I signed up to work, I was only working 8 hours a day, which would be 6 a.m. to 2 p.m. And then because now we're so short staffed because of, first of all, people not wanting to work during a pandemic, people getting sick and having to call out, people having to take self-isolation because they're showing symptoms, they thought it would be better to change our shift from 6 hour to 12 hour, just for like the next few weeks. And so that's what, or I think it's just until the month of July is over actually. So that is what has been going on and supposed to kind of like ease the burden and the load for the CNAs. But it's definitely been pretty stressful and changes the dynamic of a job, because as a certified nursing assistant, you are having so much patient like contact, and you're having so much contact with your doctors, with the nurses, with the rehab, with so many people. It's a very high contact job that I feel like I'm literally in isolation, even though I just come home, because I'm having so much contact, which is actually really scary. And I don't know, like you go to work and you just kind of are like, try not to think about it, try to do the proper PPE. I'm now wearing 2 masks. I used to just wear 1, but now I'll have like a cloth mask and a surgical mask. I also have a couple N95s because my mom's a nurse. So I haven't used those yet, because if things start escalating more, I have like a few of them, so I want to save them. I feel like I need to whisper that I have N95s. Isn't that crazy? Like what? Like literally, can we take a second? And I said the other day, I was like, yeah, the virus has changed so much. The virus. And it's like, this is stuff you read about. Like, this is just so unreal. And I think people are really dehumanized to the fact of what's going on, which is just society in general to so many horrible things. But like, the virus, like people are literally losing their lives, and it's really scary. Like I'm scared all the time, and I'm still going to work. And I'm just like praying and hoping and like thinking that everything that I'm doing, I'm very thorough. So like basically when my shift ended, I came home, took a shower, put my scrubs somewhere else, like completely scrubbed with antibacterial soap, really picky about where I'm putting my masks, my gloves, all that kind of stuff. But it's just like, the crazy thing is too, that I kind of wanted to talk about in this video, is that like I'm working in a healthcare setting, and I'm seeing the data, and I'm seeing the statistics, and I'm seeing the numbers about what's going on in the world. And there's a lot of people that just think that COVID is fake, and there's a lot of people that aren't social distancing. There's a lot of people that aren't wearing masks, and even people that I know in healthcare settings that are professionals and employees. It's just really crazy, because there could be like 95% of us doing proper PPE, and then 5% of us are like, I don't believe in this, and it could get every single person infected. And it's just, I think the time that we're in, it's definitely a time of no other, and like it's a time to sit down and reflect. But especially for healthcare, and you really realize like how one thing can change everyone's lives, and how important and how fragile life is, which is the biggest lesson and blessing. But I don't know, it's been really interesting. I never foresaw this happening, and I do have like my moments where I come home and I'm like, what am I doing? Like, is this worth it? Like, I'm risking my life, and I don't know if it's worth it. Like, I have my whole life to live, so it's kind of crazy. But I mean, I thoroughly do enjoy what I'm doing. I think being a CNA is super rewarding. It's a job that I really love. It can get really exhausting and really draining at times, but I really love connecting with my patients and my residents, and I have a really like positive work environment with my coworkers, and I'm really, really happy about like just everything else, the location, and just kind of like the adaptability. And I've learned so much. Like my first day of work, and this isn't the case for all CNAs and like every CNA job, but because we do have like a wound nurse on site, I was able to go in and like see firsthand how the wound nurse goes in and cleans a wound, and I was able to assist with that. And it was like literally so insane, and I forgot that I was at work. I was like, oh yeah, we're working right now. Like, I don't know, it was just really cool. So I'm really, really happy. If you haven't seen my last video, I talked about how I was going to go to law school, and I'm going into medicine. So far I've been really like enjoying a lot of the medical experience that I've had. I have no idea what's going to come out of all of this, because I know that I'm not invincible, and I don't think that I am just because I'm young. Like, I definitely know that I have just as much of a risk to get COVID as an elderly person next to me, so on and so forth. And it's just, I can't foresee the future, and a lot of us are like, I can't wait till this is over and we can go back to normal life. And it's just like, if you think about the study of viruses and vaccines, the truth of normal life post COVID, or post mask, if you want to call it, is definitely, normal is changing and adapting. So it's definitely a time of reflection, but I kind of wanted to share that with you all. I'm gonna end the video on that. Everyone, please stay safe. Please wear a mask. Please social distance.